And thank you for joining us here on PM Express. Well, in this year, since the year began, 2023, there has been one major health issue that is now beginning to get some traction. And tonight we're going to spend some time on that. It has to do with our children, the babies that are being born right now. They risk significant exposure to jeopardy as far as health is concerned, because as we are now learning, countrywide, we're experiencing a huge shortage of child immunization vaccines, which has put thousands of babies' lives at risk. And we're going to get into the bottom of this. We know the health minister has been summoned to parliament. He hasn't showed up yet, but the health ministry officials, some of them have gone, and we're beginning to learn a bit more pretty shocking stuff as far as this is concerned, because also it has to do with vulnerable babies. And at the time when the world is moving towards the elimination of these childhood killer diseases, it begs the question why we find ourselves in a place where, as a country, we're unable to provide basic immunization for babies born in this country. And as we know right now, the vaccines for routine immunizations of babies from birth to at least 18 months are now in short supply. The minister was supposed to appear before Parliament and has failed, but we will get some clarity because the Health Committee in Parliament now are telling us that they've actually have met some officials of the Health Ministry, and the stuff that they've been told, not good news indeed. And if you look, the graphic has done some extensive work on this, and the types of vaccines in short supply are the ones that the babies need the most. Particularly, one that caught my attention and I want to emphasize is the BCG. And the BCG, we'll talk to a pediatrician who will tell us what it is, but it in essence is one of those that the babies would need at birth. So if you were born, and this is the entire year, so if you're born in January, you need it at birth, because you possibly will be exposed to the disease that this particular vaccine is supposed to prevent. You won't have it, and that places the child great exposure. And that's one of the basic problems that we're beginning to face. And the Ghana Health Service has been speaking about this. They admit 3 basic vaccines are in short supply. In fact, they are not in stock at all anywhere in the country. This is the polio vaccine, the BCG that I talked about, and the measles vaccines. These 3 are in complete short supply. So if you're currently looking to immunize your baby against polio and against measles, you won't find it. And the challenge with this is you can't find these vaccines anywhere else. You can't get it in a pharmacy. You can't get it in a private health facility. It's only a government-supervised immunization procedure. And so even if you have money, you can't. You possibly be the richest person in this country. If you have a baby today and you need BCG at birth for your baby to survive, you won't find it anywhere in this country. And that the Ghana Health Service themselves have said this. And this is the Ghana Health Service boss who says they're working with UNICEF and other partners that to get the vaccines in the next 2 weeks. And that's a challenge. Will we get in the next 2 weeks? Because this has been the case for the entire year. And it's now beginning to come up, so promises are beginning to be made. But if you put this in a global context, you begin to see a certain drop-off in terms of the children missing out on vaccination. 25 million of that in 2021 alone, 6 million more than 2019, the highest number since 2009. And that is definitely a problem on a global scale. Now, we know that the vaccines reduce risk of getting disease, working with your body's natural defenses to build protection, but even more pronounced for a baby. And currently it prevents between 3.5 and 5 million deaths. And so that tells you a story. In Ghana, we have high numbers of childhood deaths. And part of the reason is already parents aren't taking their children to be immunized. And now they want to do it, they can find the vaccines for that purpose. But I find this more troubling, this particular graph that you see there. Deaths caused by vaccine preventable diseases, right? In children, in babies. In other words, These numbers that you see on my screen are completely avoidable in this country if you took the vaccine, if you are immunized, if you take your babies to be immunized. And that is why it's shocking that the Ghana Health Service, they have this data, and yet somehow a procurement challenge, and we'll learn a bit more about it, because I'm told the monies have actually been released, and somehow the vaccines were not procured, apparently because of depreciation of the cedi. We'll get some clarity, but let's look at the numbers. Tuberculosis, since 1990 to date, so 2019, if you're looking at our world data, we talk about 319,000 children have died for tuberculosis, and that should not happen because there's a vaccine for it. If you look at meningitis, 128,000 children have died because of that. There's a vaccine for it. It shouldn't happen. Measles, we have 74,000 babies have died as a result of, vaccine preventable disease. You just immunize your child, and your child is safe against it. So these numbers tell you a story. Even if one child dies, if you've been a parent before, you are a parent, you will know how devastating this is. And so this is a big deal. We're going to get into that. When I return from the short break, I'm going to bring in my guest, and I will expand this conversation. We're trying to understand why this has happened, but most importantly, can we fix it, and why we haven't fixed it already? Why have we waited? It's the first 2 months have gone already. We'll get into the details after this break. Stay with me. Joining me tonight is Kwabena Minta Kando, is a ranking member on the Health Committee of Parliament. Dr. Emmanuel Eifa is the Deputy Country Director of SEND Ghana, and they've done some work on this particular challenge. Perpetual Furian-Pofo is the President of the Ghana Registered Nurses and Midwives Association. Joins us for a quick chat on the phone. Oswald Evans Mensah is the Acting Director, Corporate Affairs at the NIA. Also joining us is Professor Janet Nikwe. He's the former head of Child Health Unit at the Kolebu Teaching Hospital. Also joins us on Zoom, and I'll quickly get her thoughts on why these vaccines are so critical for children within that age bracket, between 0 to 18 months, very shortly. But I want to quickly get the official word on the challenge with the vaccine supply. I want to bring in Evans Mensah with the NHIA, and he joins us right now. Thank you very much, Evans Mensah, for your time here on PM Express. Please help me appreciate the challenge. I know the NHIA is pretty central to the procurement in terms of the releasing of the funds to the Ghana Health Service for the procurement of these vaccines. What has been the challenge? Has the NHIA released these funds as we've been told?
Good evening, Evans, and thanks for having me. Yes, I can say categorically that NHIA, through its mandate, legal mandate, because we have an obligation to pay Ministry of Health under the framework of approval from the allocation program by Parliament. As you've stated rightly, the figure of about 72 million this was earmarked for support to Ministry of Health for public health and preventive care and health service investment, of which the amount has been duly paid to the Ministry of Health. I must also state that this payment, even though it's coming out from the NHIA, is made to the UNICEF, it's made to a UNICEF account, because the program, as it were, is run between the Ministry and the UNICEF under the Gavi program.
Okay. So when did the NHIA release the 72 million cedis?
The payments for these releases are upon request from the Ministry of Health. I want to believe that the records that I have state that payments were done in June, somewhere in October, November, and the final one, I believe, was in January of 2023.
Okay. So as by at least the beginning of this year, all 72 million was already released and cleared.
That's correct, Ivan.
Okay. So when you hear that the vaccines you've already released funds for are still not around. The Ghana Health Service has confirmed that the entirety of this year, they haven't managed to procure the vaccines. I wonder whether the NHIS have tried to figure out why.
Of course, the situation is disturbing, but as you know, the NHI is only a payer within the healthcare financing architecture. So the Ministry of Health, of course, being our mother ministry, is responsible for the procurement and administration of that facility. So yes, it's worrying and it's disturbing to find out that the drugs are in short supply, but I believe that the administration of that really works for the ministry.
Okay. And the 72 million CDs that was released for the procurement of the vaccines, will it cover the entire year or was for a part of the year?
That is what the 2022 fiscal year mandated us to pay. So the full amount has been paid. Okay, so
it presupposes that once that has been released and we procure, it should cover what we need for the entire 2023.
Absolutely so.
Okay. Mrs. Shamasa, please stay with me briefly because I know that the Health Ministry have been to Parliament, I believe yesterday, to give a briefing to parliamentarians as to why this has happened, although they've received the funds from the NHIA. Kwabena Minta Kando will join us briefly to get us clarity on what the ministry, the Health Ministry, told them why they've not managed to procure the vaccines, although they have the monies. But why is this important? I want to bring in Professor Janet Nikwe. He's a former head child health unit, Kolebu Teaching Hospital. Prof, thank you very much for agreeing to talk to us tonight. I'm really delighted to have you because I really want to understand why this is so critical. So just to start off, the Ghana Health Service confirmed that in terms of the nationwide shortage, the types of vaccines that are completely not available, there are 3 of them. The rest, you will find them in places and bits and pieces. But for these 3, you can't find them anywhere in this country as we speak tonight. Polio, the polio vaccine, BCG vaccine, and the measles rubella vaccine. These 3, the Ghana Health Service confirms it's in complete short supply. Please explain to me as a health professional in this area, this is your expert field, why these 3 are so critical for the survival of babies when they are born.
Can you hear me?
I can, thank you very much.
Okay. Well, BCG is given to protect babies against tuberculosis. It doesn't give absolute protection, but it helps to stop them dying from tuberculosis. And it's been found that birth is the most convenient time to do this. It can be done later. So if the vaccine is in short supply, it can be done later. It's just that mothers are very, very busy people and they have scheduled in to do it, and then later on they may not have the same time available. Polio is very serious because there's been a wide world effort to eradicate polio. It really has only existed now in remote areas in Pakistan and Nigeria where there is vaccine hesitancy. So if the vaccine is not there, it induces people also to say, oh, well, if it's not there, so what? And polio can rear its ugly head again. This leads to paralysis in children. It's very important to try and eradicate it. Measles is a very dangerous disease. We used to have a lot of measles in Ghana, a lot of children dying from it. It's extremely infectious. So if you have even one case, then it will spread. And I have read in the newspaper that there have been measles cases in the north. Mm-hmm. So if babies do get measles, then they are very dangerously sick and it leads to malnutrition. So these days, when there hasn't been much measles because of the vaccine, we have stopped seeing cases of kwashiorkor, which we used to see a lot of.
Yeah, and please help me appreciate this. So the timelines you're looking at is from January till now. So the last 2 months, this shortage has been a problem. So how can a child survive with these three not being available? So say you're born on New Year's Day, the 1st of January. For 2 months, the child needs this, hasn't managed to get it because it's in short supply. What are the health risks for the child? And can the child survive that long, or how long more can the child survive until this becomes a real problem?
Yes, the child can survive. And it's important that those who haven't had it at the right time would catch up afterwards. This is going to place a load on the public health nurses because they will have multiple doses to give, which they should have given them at the right time. Yes. But no, it's not going to cause any immediate deaths apart from the measles one.
Okay, so the measles one, you're right. And I'm just pulling up the data that suggests from the Ghana Health Service records that already they've recorded some 70 deaths from last year alone in the northern region from measles. So that one can be immediately fatal, correct?
Yes, it can be. Presumably, some of those deaths were before the shortage, and that means that perhaps mothers up there are not going for their immunizations. And if you make it difficult for people, then the dropout rate will become higher, and therefore these diseases will spread.
Okay, and so that's a challenge we're looking at now. And you worked in the health sector for quite a while, and I need to ask you whether for mothers who are currently facing that challenge, and I'll show you a story we did today in some of the facilities where mothers were turned away. Are there any alternatives?
No, there are no alternatives. We've become used to having these vaccines available, and the system has been running really well. So I really don't understand why this has happened.
So there are no alternatives. The risk of real problems for your child is pretty high if you don't have it. And so before I let you go briefly, so as we are tonight, the challenge hasn't been resolved. How urgently would you recommend this should be fixed before this become a real proper crisis for children who have been born already, possibly at the beginning of the year?
I think it's very serious, and I hope everything is done to fix the problem. The diseases that affect also young babies, you haven't talked about, but the diphtheria vaccine and also the whooping cough vaccine is very important to get those at the right time, because if a young child aged below, say, 6 months gets whooping cough, it can cause death. Whooping cough is a very serious infection. Worldwide, we haven't got rid of it because sometimes you find an adult with a cough who has a mild form of whooping cough, but if a young baby gets it, the cough is serious and they can't breathe because of the cough. So that's a vaccine that must be given to young babies at the right time.
Thank you very much. I'm grateful that you joined us, helping us appreciate how important these vaccines are and the potential for it to cause real health challenges, including a potential deaths of children if this is not resolved as soon as possible. Professor Janet Nikwe is a former head child health unit, Kolebu Teaching Hospital. Perpetual Foriampofo is with the Ghana Registered Nurses and Midwives Association. She's a president of the association, joins us on phone. As you know, her members fundamentally administer these vaccines when you go to the hospitals. I am delighted that she could join us. Hello, Perpetual.
Oh, Evans.
Thank you.
Good evening to your other panelists.
Thank you very much for joining us. Please, your members are everywhere in this country, and so you possibly have a better understanding of this problem than anybody else does. How real is this, and what reports are you getting from your members across the country?
Thank you very much, Ivan. So this is a big problem, and we actually started receiving reports somewhere during the latter part of the third quarter of last year. that some vaccines were not available, then a bit of it will come, they will use it, and all of that. But of course, in recent times, it has become very serious. And from what we all know at the moment, the measles, rubella vaccines are not available. The oral polio vaccines are not available. And of course, the BCG vaccines are not available. We all know that BCG, which will protect the baby at birth with some kind of immunity, building up the body's immunity, is given at birth, and it's once only. Then, when you look at the oral polio, it is given 4 times, at birth, at 6 weeks, at 10 weeks, and at 14 weeks. And then you have the measles, rubella, given at 9 months, and then at 18 months. These are very critical vaccines. And like I said, the reports we are picking up is that these vaccines are not available. And when you look at our culture, when a baby is born, it's a joy. It's a joy to the family. Family members come, they want to pick up the baby. Friends come around, they want to pick up the baby, and all of that. So it puts the baby at risk for picking up certain infections, more so when the baby is not vaccinated. You asked Professor Nikwe whether there are other options. There are no options. These diseases have been there in terms of human history. And scientists have put their heads together, struggled, and were able to come up with these vaccines. And the vaccines are what protects us against these diseases. So we shouldn't be joking about it. And if these monies indeed, like your other panelist said, I did not get the name right, from the NHIS.
NHIS.
If these monies were made available, the question is, why are the vaccines not available? Why are the vaccines not available? Measles, for example, it's a very serious condition. Even when you have been vaccinated, it is possible that you can even pick up the infection and get the full-blown disease. The only consolation there is that once you have been vaccinated, the symptoms is quite mild. But when you don't have the vaccine, that is very serious, and children can die. When you talk about the polio, it causes paralysis. And you need at birth, at 6 weeks, at 10 weeks, at 14 weeks. TB, we all know. People have TB, and for some people, it is in their body. It's latent. You can't even, it is not active. So they are walking about, but they can infect people. So that, like I said, the cultural nature of the way we go about things means that if you put a child or you put a baby in a certain environment, which is not the best, it predisposes the child, especially to the TB and to the measles and rubella. When you look at the polio is transmitted, the virus is transmitted through contaminated water or food and sometimes contact with infected persons and all of that. So the advice I can give at this moment is that the vaccines are not available, but parents, mothers, should hold their babies close to them. The culture of handing over babies, newborn babies, to one person or the other, and people coming around, they should protect their babies from all of it, because you may never know. And when it comes to the kind of fluids that are given to these babies, they should make sure that it is safe, it is wholesome, and that if children have to be given any water, for us as nurses, we educate them. Breastfeed, just exclusive breastfeeding till 6 months. But not all parents are able to do that. Not all mothers are able to do that. And they end up giving them water and all of that. They should make sure that if they have to give these babies water, it is wholesome water. Because if they don't have all the OPV and the BCG at birth, we should protect them. It is quite serious, and as a nation, we should take this as a public health emergency and get these drugs from wherever we can get them, so that the API of the Ghana Health Service can deploy them, and our nurses, our community health nurses, our public health nurses, stationed all over the country, can actually give the vaccines to the babies.
And I really like the point you made at the end there. Take this as a public health emergency. I will explore that a bit more because it's such an important subject. And it's coming from you, you know what you're talking about because your members are administering this on a daily basis and they are having to turn away parents. Today we found that in Adabraka Polyclinic. It's difficult for the nurses to explain to the mother who had come in with a baby crying that I cannot help you because it's just not available. Minta Kando is a ranking member on the Health Committee in Parliament. They've been investigating this particular matter, and I'm grateful that he joins us. Mr. Minta Kando, we've just heard from the NHIA confirm that as far as they're concerned, they've already released all the money that the Ghana Health Service requires to bring in what we need for this year. And yet we have a shortage. We're just listening to the Registered Nurses Association president confirm that the problem actually started towards the end of last year, the last quarter of last year. It just become even more acute this year. What have you established is the reason why, although the Ghana Health Service and the ministry have the money, they have failed to procure the vaccines?
Yeah, Evans, let me say good evening to your viewers and make the point that after getting the opportunity to listen to the National Health Insurance Authority and the ministry, together with the Director General for Ghana Health Service and the two deputies in the Ministry of Health, I have come to the conclusion that this is a disaster, sheer wickedness, and it's quite avoidable, Evans. Evans, let me give you the rundown. Don't forget that the spread started somewhere last year in October in the northern part of the country. And so somewhere last week, we invited as Parliament, that's the Health Committee in Parliament, invited some agencies and the Ministry of Health to appear before the committee to answer some questions. Now, we met yesterday.
Unfortunately,
National Health Insurance Authority to see. Can you hear me, Evans?
I can now, yes. We lost you just for a second. So I lost you, yes. Go on.
Okay, so unfortunately, the minister and his team didn't turn up in the first instance. So we gave an ultimatum that they should come to the committee within 2 hours later. So Evans, after 2 hours later, we saw the two deputies in the ministry and the chief director and the director general for Ghana Health Service. So we asked them questions. And before then, when the National Health Insurance Authority appeared, we brought all the formulae. You know, every year, Parliament has to approve the formula for the National Health Insurance Authority. And Evans, we have realized that there's an allocation in the National Health Insurance formula for the purchase of vaccines. This is not government money. This is National Health Insurance money paid by you and I. And Evans, it is highly unacceptable that is the only source of funding for vaccines in this country. Highly unacceptable. And nobody can convince me. Highly unacceptable. Now, upon the interrogation, what we realized was that the monies have been released. That is, the National Health Insurance allocation has been released. About 72 million Ghana cedis was allocated, and that has been released from last year. Okay? In answering their questions, we realized that the ministry, together with Ghana Health Service itself, they were confused. Because Evans, you don't pay for vaccines or you don't plan for vaccines within that same year. So whatever allocation is made in 2003 is supposed to take care of 2004. That is how you plan. And so if 2022 allocation has been released, the 2022 allocation was supposed to be for 2023. If 2021 allocation has been released, it is supposed to be for 2022. So you don't wait till everything is gone before you start throwing your hands in despair. Now note that, as the earlier speakers have stated, that these are vaccines, and you cannot purchase vaccines over the counter. So even if you have the money, you cannot have the vaccines to buy. And so these are sensitive issues that we must always plan, and under no circumstances should we wait till all vaccines are finished before we start thinking about, replenishing the stock. Now, one of the most ridiculous answers that was given was that at the time they attempted to pay, there was this fluctuation of, the cedi, very steep fluctuation of the cedi, and therefore they were waiting to see how the cedi, the depreciation will go. It's quite ridiculous. You cannot say because your currency is depreciating, you will not buy vaccines to take care of, vulnerable children in this country. So in summary, all the reasons they gave before the committee are not tenable. And so we told them to go back and bring their minister to appear before the committee, because it looks like there is no hope. There is absolutely no hope, because we realize that they were owing in arrears. They have some arrears to clear. And there are two types or groups of vaccines we are looking at here. We have the Gavi co-funded program and the ones we pay for 100%. And we are owing in all these vaccines.
So what it means that government is owing the suppliers of the vaccines?
Exactly. Those who are supposed to supply us because if you don't pay, they won't break. It is only the Gavi one that Gavi's position is that, look, if government don't even pay, we will bring it because we won't allow the vulnerable babies to suffer the sins of government. But the ones that we are supposed to pay 100%, not until we pay, we cannot get the vaccines. So it's purely money issue.
But they had
less, more.
But they had 72 million CDs in hand.
That is the question. That is the question. And you see, their mathematics were even not adding up. At the committee, at one breath, they were saying that they needed about $18 million, dollars to be able to deal with it. Now you have the opportunity to do allocation in the formula. And you say you need 72 million, even if you take the exchange rate around 6 point something, as at 2022, early part of 2022, you still cannot get your 18 million. And you cannot tell me that the only source of funding for this program is the National Health Insurance Formula. That is highly unacceptable. Nobody can convince me. And so it is recklessness, negligence, sheer wickedness. As I speak to you now, as far as the committee is concerned, we've not had any reasonable excuse or explanations that we think that it's about the consumption of
Mr. Akanlo, so this 72 million, so where is it? Is it still in the UNICEF account, or have we now made the procurement?
Account. It is as far, according to them, these monies were paid into UNICEF accounts. What we don't know is that whether or not we were owing, there were some outstanding debts. That is what we are yet to establish.
So have we now procured the vaccines and they are on their way?
Well, when we asked them, they gave us the assurance that as of yesterday, within 1 week, we'll have some quantity of vaccines. But they didn't give us any stronger, whether or not they have paid some money, and that is what is bringing us these vaccines. Or, it was a mere assurance without any concrete basis. So we told them we cannot accept this, because don't forget that I've told you that the thing started somewhere in October last year.
Yeah.
And we have looked on concern, and it is now fast spreading. It is now coming to the Brongahavo area. Today, I was told that some has been recorded in some part of the Volta region. So it is now spreading at a very fast rate to the southern part of the country.
So
it's a very...
Yeah, Mr. Akanlo, thank you very much. Please stay with me. I want to bring in Send Ghana. Dr. Ayifa joins us. He's been on and has listened to everything. And I know Send had done a national work on this particular problem. Mr. Ayifa, so now we understand, at least from the Parliament Health Committee's point of view, what the challenge is, although the money is available. What have you yourself as Send Ghana established across the country as far as this challenge is concerned?
Thank you, Evans, for the opportunity, and good evening to your cherished viewers. Indeed, the signals we are picking recently is not very different from our monitoring somewhere from mid last year. Indeed, Send did some work which we are yet to publish. That is looking at immunization budget credibility across some districts in Ghana. And so, in fact, as around October, November, indeed, we established that in the district that we worked in, which had some districts in the north and then in the south as well, South Sudoku, Sojaman Ho, Tatalis Agnuri, and Kasina Nankana. These districts, we established that there were indications of they not having vaccines available. And fast forward, when we had a national stakeholder dialogue, other participants who were not from this district and from other districts also established same. And some of us began to really ask the questions. Nasikano Wahi asked to wait in our local language, where is the money? Because we had picked indications that the NHIS had actually released some money. And so that has been the question that we keep asking. For how long should we pay lip service to something that borders on the livelihood or the life, of children? We believe that government need to act and act well. I mean, look at the flimsy excuse that they've given because of the depreciation of the city. This is something that we cannot take as a people, and especially for all CSOs, we do not think that that is how it has to be. Let me just find out from them. I'm assuming that it was going to be something that has to do with a key political decision. Are they going to tell us that because of the depreciation of the city, they are not going to act? Honorable Akando, I really want to thank you and your group for what you've done, the Select Committee on Health. But however, I want you to possibly probe further, because I do not believe just to say that UNICEF, the money has been sent to UNICEF. I don't know whether they really gave you any receipts to indicate that the money has been given to UNICEF.
Yeah, I mean, Mr. Efa, on that point, let me quickly do another establishment of that point, because it is NHIA that pays. And thankfully, Evans Mensah was with us at the beginning. Let me quickly get him to confirm that, and he can take leave of us if he's still on. Mr. Evans Mensah, are you still with me?
Yes, I'm still here.
Yes, okay. Very finally, you had the question there. So when NHIA made the payment, did you make it directly into the account of UNICEF or to the or to the Ghana Health Service?
We actually paid to the UNICEF account.
All of the 72 million CDs?
That's my understanding.
Okay. So, and that has been the practice over the years?
That's correct, Ivan.
Okay. If you don't mind explaining to me, why doesn't it go to the Ghana Health Service but to a UNICEF account? Can you explain why that is the case?
I will not be able to explain that, unfortunately. But as I did say, we are payers, within the spectrum of the healthcare financing. And the procurement administrative angle of it is really handled by the ministry and the Ghana Health Service. So we are only directed or instructed to pay to the payee for the drugs to be available.
Okay. And this has been the practice all along?
That's my understanding.
Okay. Thank you very much, as well, the Chair Minister, for offering us that clarity, and he will take leave of us now. So yes, Dr. Ifa, that's the clarity. So the NHIA paid directly into that account. The question is whether that money is just sitting in the UNICEF account. Yes.
In fact, you remember that we had a similar issue as far as the COVID-19 is concerned, where we've been told by the Auditor General's report that as much as 80 million or so Ghana cedis also was paid, but the vaccines were not delivered.
Yes.
Indeed, one of our partners was in a high-level Gavi meeting, and it came up that, the description of Gavi to Ghana is so sad that we have become a stubborn child as far as immunization co-financing is concerned. As a Ghanaian for sitting in a meeting for people to describe sex. Of course, I wasn't there, but that is the information we got. I mean, I wouldn't really feel very proud as a Ghanaian for such description, because consistently we have been defaulting on our part of it. So for government to give this flimsy excuse, I do not buy it. San Ghana, we do not buy it. And I do not think that any civil society person will really take this as any good excuse. The point is, if even we didn't have enough money, possibly to show up how much has been paid by NHIS, because per my calculation, the NHIS money amounts to about $5.6 million. And if you look at our co-financing obligations for 2021 was around 5.3. 2022 is around 5, projected is around 8 million cedis or so. Granted that even how much NHI is paying is not adequate. I mean, there are a lot of other sources that we could get money from. What did we use the COVID-19 health levy for? That we roped in about 1.5 million last year. And so I do not think that government, especially Ministry of Health, is really being truthful to us. We contacted EPI several times. Up to now, they are yet to respond to us. And so if they don't have anything hiding, what prevents them from actually always being truthful to some of these things? I don't just get it. So I believe that this is a clarion call for whoever is supposed to. In fact, if we were in any country, the Minister for Health should have been shown the exit by now. And this is not the first time. During COVID time, we had similar things happen. And the Minister of Health always found excuses not to appear before Parliament. It's about time the President showed him the exit. And whoever also needs to go, I think that has to be done, because it's about the health of the Ghanaian child, and every Ghanaian child matters. Let me just say that I'm not an expert as far as pediatrician is concerned. The pediatrician spoke about the dangers of measles and whatnot. What we read from literature is that it even has a tendency to cause brain inflammation. So we run the risk of most of our kids.
Yeah, and earlier you had the registered nurses president indicate that as far as they are concerned, this should be declared a national health emergency. Is this something that Sen Ghana supports?
Yes, we totally support it, because, you know, this thing starts from a small note, and if nothing is done, it escalates. Okay. And that is what we are seeing. Yeah. I know that a lot of cases have not been reported. And so I believe that it should be a national emergency. And for that matter, we should treat it as the way we would treat any emergency.
Let me bring Mr. Kando back in. Mr. Kando, so clearly you were not satisfied. You wanted more action. I wonder what next for your committee in trying to get to the bottom of this, but most importantly, ensure that the vaccines arrive for those babies who urgently need to get it. What's the committee's next line of action?
So for me, the explanation, the submissions from the minister's main delegation can best be described as a disaster. And so the next is that they should appear before the committee on the 7th of March with the minister himself because Evans, if indeed, just like we are all saying, if indeed we have paid some money into UNICEF's accounts and we don't owe them, why should they not supply us with the vaccines? Why shouldn't they? So we think that there is something we don't know yet. And the only person who can tell us that is the minister himself. Because Evans, what I realized yesterday was that almost all the members of the delegation were panicking when we were asking them the questions. It looks like they were afraid to fall into certain traps, and the answers they were giving were not coherent. Clearly, for me, there's something, behind the scene that we have not been told, and we need to go to the bottom of this matter. Evans, this issue, this situation is a very, very sad situation. A country that we have almost succeeded in eradicating all these diseases. And just like I told you in the 6 o'clock news, that the last time we recorded measles death was somewhere in 2003 or so. And all of a sudden, it is spreading at a very fast rate. And now they tell you that, look, once babies are born and taken back to their destination, even if you have the vaccines, getting the coverage is even very difficult, and it will even increase the operational cost. Why are we doing this to ourselves? And we are yet thinking about how we build, cathedrals. It's quite disheartening when you sit on such committees and hear some of these people speak. And, the zeal with which they attempt to defend these things is quite annoying. So for me, Evans, we have, and you see, it's about time we begin to show interest in health issues in this country. You cannot tell me that we should leave the burden of procurement of or allocation to vaccines on the National Health Insurance Authority or National Health Insurance Funding alone.
Yeah,
we should have some multiple sorts of funding.
And
you made this point several times.
Yeah, you have, and I am grateful that you did. I want to go to Perpetual Furiampofo because he had an advice for mothers who recently have given birth, and I want to end on that note because right now you wouldn't have a choice because the vaccines aren't available. You can't find them. But what can you do to mitigate any impact? Perpetual Oforiampofo, if you may, you made that, you delivered that advice earlier. Please repeat that because it's so important. Many mothers are being turned away, but they need to survive. The children need to survive until the vaccine is coming. We don't know when. So what advice, again, were you giving the parents?
Okay. So all that I'm saying is that when you look at these vaccines, and what they protect these babies or infants against. If you take the measles rubella vaccine, which will protect the baby against measles and rubella, it spreads through the air, through cough, sneezing, contaminated items, and so on and so forth. If a mother has it, it can be transmitted to the child. If you take BCG, protecting the baby against TB, the virus or the bacteria is also spread through coughing and sneezing and all of that. So, and when you take the polio, like I said, contaminated food, water, and other sources of contact. So they should keep their babies close to themselves and ensure that they are not handled by so many people. And like I said earlier, our culture is such that people will carry your babies, your in-laws are there, your own siblings are there, and your older children are there. But they should protect the children so that they are not handled by too many hands.
Okay.
The hands of the mother should be enough, or the hands of the parents should be enough, so that they can, especially the babies who are supposed to have the BCG at birth and then the polio vaccine at birth, they should keep them closer and let them grow as they breastfeed, and they should breastfeed them very well, so that the natural immunities within the breast milk can also fortify the babies against some of these infections. It will not be enough, but at least it gives some natural immunity to the child. So breastfeeding, and to be able to breastfeed well, it means you, the mother, must also eat well so that you can produce enough breast milk for the baby. And as much as possible, they should not introduce water to them at those very early ages, especially between 0 to 3 months. They should avoid giving them water and all of that, and protect the babies against taking in any such contaminated water or fluid. And if for those babies that have started eating normal food that is eaten at home, they should ensure that food that is given to the babies are also wholesome. It must, when it is cooked, it must be stored well, and when it has to be given to the baby, it must be heated properly so that if there are certain organisms in it, it can it can actually die off before the baby is fed with it.
Okay.
These are very important things. But let me add that these are very vulnerable patients of ours. Babies or infants are very vulnerable patients. Most importantly, they cannot even talk. They cannot communicate what it is that they are feeling in their body. And it is the mother, the caregiver, who must be able to interpret what it is that they are communicating through their crying or through their gestures. And it is very, very, very important that from whatever sources that we have to get these vaccines, we should get them into the country as soon as possible. In the medium to long term, we should, as a country, be looking critically at developing some of these vaccines ourselves.
Okay.
Somewhere last November,
and that has been one of the most important things, indeed, in the conversations post-COVID. And I'm grateful, Perpetual, that you brought that up about trying to look inward when it comes to these vaccines. I'm grateful. Just ran out of time on this. But Perpetual for Ghana Registered Nurses and Midwives Association, LA Head Dr. Emmanuel Yufal, the Deputy Country Director of SEND Ghana, Minta Kando is a ranking member of the Health Committee, and then Professor Jenna Nikwe also joined us. He's a former head of the Child Health unit at the Kolebu Teaching Hospital. Of course, he had the Ghana Health, the National Health Insurance Authority. Oxford is Evans Mensah, who's the acting director there. And earlier, I had made the point that about 70 cases of fatalities have been recorded in the north because of measles. That is wrong. It is actually 70 positive cases of measles that were then recorded last year in the northern region, and that is the number, not deaths, but positive cases. Enjoy the rest of your evening.